I'm Cami. I'm going to be your nurse today. So I see that you've been recently diagnosed with type 1 diabetes. Are there any symptoms kind of that you're experiencing that might have brought you in today?
I've had a few fainting spells and just overall not feeling good.
Okay.
And she hasn't been eating these days. Yesterday, we went to Kroger and we were trying to buy some food so we could eat. And then she passed out in the middle of the store.
Okay. And who are you?
Greg.
Greg. Nice to meet you, Greg.
Nice to meet you.
Are you brother?
Boyfriend.
Boyfriend. Okay.
Long time.
Gotcha. So you admit to skipping meals?
Yes, skipping some meals and probably not eating what I should be.
Okay. And are you skipping those meals because you just don't feel well, or are you skipping them for another reason?
I just feel like I don't know what I'm supposed to eat.
Okay.
It's all that McDonald's these days that we've been eating. Honestly.
Okay. And then along with your normal symptoms, are you feeling like your mood? How's your mood?
Overall not good. I just feel like I can't do anything anymore with my friends or even my boyfriend.
Okay. All right. I'm gonna go ahead and take a listen here. All right. I'm gonna go ahead and take your blood sugar. This will just give you kind of an initial reading, just so we can make a plan based off of what your blood sugar is. So I'm gonna go ahead and prick your finger, okay? Clean it with your All right, so your blood sugar is coming back as a 73, so that is very low. That could be due to you not eating meals frequently. So we're gonna go ahead and go make a care plan for you. I'm gonna talk to some of the other dietitian, physician, everything, and we'll get something figured out for you. So I'm gonna go document all this, and then I will be right back to check in on you, okay?
Okay, thank you. I can't believe you would tell them that I've been fainting. It's really embarrassing.
Well, it was embarrassing for me when I had to drag you out of the store like that. How do you think I feel? This is just ridiculous.
This isn't about you.
I just can't even believe that you're diabetic. Like, this is nuts. How do you think I feel? I just can't believe this. Like, if this keeps going on, like, I'm just gonna have to leave you.
Are you serious?
I'm as serious as your diagnosis, Chloe. You know what? I just need some time for myself. I need some air.
All right, guys. Well, thank you for coming. So we just have a few things to discuss. We have a patient named Chloe. She is a 20-year-old Hispanic female. She has just been diagnosed with type 1 diabetes. So I went in and just kind of did an initial assessment. I asked her how she's been feeling. She is experiencing fainting spells and just not feeling good overall. She did admit to me that she's not eating. She is skipping some meals and she doesn't really know what to eat. So as a dietitian, I thought maybe you could talk to her about that and maybe make a diet plan for her.
Yeah, no, we definitely want to make sure she's obviously keeping low on the carbohydrates and sugars. Did she say why she's not eating?
Mainly it was just she doesn't know what to eat. She doesn't feel very good. She wants to make sure that she is eating the right foods, but every time she eats, she just feels like they're the wrong ones.
Gotcha. Yeah, no, we can definitely make a care plan for her for that. Try to keep her on the same kind of diet daily, make it easier to control her diabetes, make sure she's checking glucose levels throughout the day.
Perfect, that sounds great. So I'll have you go in and talk to her after the meeting and just let her know what you have planned for her.
Sounds good.
And then, what were you thinking? Were you, like as a physician, any medications you had in mind for her?
I think the best thing to do is to give her regular insulin, about 14 units, and we'll give it sub-Q at meals and at bedtime. And then we should also give her 12 units of Lantus. We'll do that sub-Q as well at bedtime.
Perfect. All right, so can you go ahead and give pharmacy a call and get those?
Yeah, I'll go ahead and call pharmacy and let her know.
Perfect. And then for you, I did, when I was documenting, I did just notice a little scuffle fight argument between her and Greg, her boyfriend. So I thought maybe you could go in and kind of figure some stuff out. They were mainly just arguing about her diagnosis. He was just kind of maybe he's stressed, maybe he doesn't know how to deal with it, but he did end up leaving the room to get some air, so it could be intense.
Alright, well, I definitely see some psychosocial concerns, and especially a lack of support. I understand that her mother is out of town right now,
Yes.
and if the boyfriend is kind of acting out, then she definitely needs to be spoken to. I'll probably have him leave the room, because I'm sure there are a few concerns that she's not listening. And I really want to talk to them about their financial stability, because I can get them resources to help with that, of course, especially her being on 2 separate insulins. And we definitely want to sort out where the not eating is coming from.
Right.
And I know I read in her chart that she had some concerns about not being able to keep up with her friends and do the same things that she was able to do. And I want to reassure her that she can still do everything that she was able to do.
Great. All right. Well, that all sounds great, all of you. I think we got a good plan together.
Okay.
All right.
Good. Hi, this is Dr. Lewis. I was just calling about Chloe's spoon 3901. I was calling to place 14 units of regular insulin sub-Q and 12 units of Lantus sub-Q.
Hi, this is Lanisha with pharmacy. Okay, great. I just wanted to confirm that her prescription is being sent to the UTMC pharmacy that's at 3000 Arlington Road. Okay, I'll get the prescription going and it should be ready in about a couple of hours.
Hi, Chloe. How's it going? It's okay. I see that your boyfriend left. Is there anyone that I can contact for you? You can call my mom for me. Your mom? Okay, sure, yeah. Okay, I'll give you some time and I'll come back.
Hello.
Hi, Mom. I'm really scared and worried. And Greg just left the room and he's like threatening to break up with me, and I don't know what to do.
Oh, hi, honey. How are you feeling? Oh, I'm so sorry, babe. I know everything's gonna be okay. And if you need me, I'll come up there and visit you, okay? Just listen to the nurses and the doctors, and everything is gonna be okay, all right? Okay, honey. Okay, call me if you need me. All right, I love you. All right, bye-bye.
Thanks, Mom. I can't wait to see you. Love you. Bye. Right, so I just wanted to talk to you a little bit about your situation and just go over what you said earlier with the nurse. So I heard that you were skipping meals, and was that like an issue? Like, how long has this been going on, do you think?
Maybe a couple months.
And this was because you weren't feeling well, or was it anything possibly to do with self-esteem at all, or any of your friendships, relationships?
Maybe a little bit, because I feel different from my friends and I'm just not really sure what to do.
I also just wanted to hello.
You're in my seat.
Well, actually, I just wanted to speak to Chloe alone for a little bit.
Get
So,
out, Greg, right
Hey,
now!
I thought we were good.
No.
If you could just wait a few minutes, we'll be done with this interview in a little bit.
I don't even understand. Whatever.
Thank you.
Hey, anytime.
So sorry about that. But I did also want to talk to you about any financial concerns. I know your mother's not here, and I'll speak to her directly about this. But I just wanted to let you know we have resources if you can't afford the medication, because we know that's where a lot of patients tend to stop keeping up with their diagnosis because they can't afford it or can't pick it up. And I also just wanted to let you know there are support groups and there are lots of resources to help you transition through this. And I understand that you're having concerns about fitting in with your friends. Can you tell me a little bit more specifics about these concerns?
I just feel like I'm on a different track than them with my new diagnosis, and I'm just really not sure how to like fit in with them. I'm not really sure what to do.
Right, that's understandable, but I can assure you that once you start getting on these medications, and we'll teach you the proper technique of doing that, nothing is really going to change. You will have to eat a little better, and the dietitian is going to give you a meal plan. Like, once we get started on this plan, you can do everything that your friends can do.
Thank you.
Yeah, and if you have any questions, you can contact your nurse or me or your dietitian, and we'll be with you.
Thank you.
Hi, my name is Bailey and I'm the dietitian here. I just hear that we're having some issues finding foods to eat, keep you on a good schedule. I do have a book here with foods to eat and not to eat.
Okay.
We really want to eat fresh fruits and vegetables, make sure we're eating natural sugars. You kind of want to stay away from the processed foods. So things high in carbohydrates, sugar, stuff like that, we kind of want to stay away from. I'm not saying you can't eat it, but you just want to take it in moderation. After eating things, you do want to try to check the blood sugar, make sure you're not going too high, otherwise you might start feeling a little bit sick again, kind of what you're feeling now.
Okay.
But I would really just stick to that book. If you do have questions, you can definitely reach out to me. Again, my name is Bailey, or contact your nurse. We're all here to help you.
Thank you.
Babe, are you awake?
Yeah.
I just want to say I'm sorry. I've just been so stressed. Just with you fainting in Kroger, that was just upsetting to me because I had a really big question to ask you, but I thought to myself, what better than to just do it here?